Hi, I'm Dr. Seema Manjunath, fertility consultant at Cloudnine Hospitals, Thanisandra, Bangalore. Recurrent implantation failure is when the transferred embryos fail to implant after having multiple IVF cycles. Now, the implantation is the first step in the crosstalk between the embryo and the endometrium for a successful pregnancy. RIF is a complex phenomenon where there is multiple factors which is affecting the implantation. It could include the male factors, the female factors, or the embryo factors. Hence, the evaluation also is likewise. Coming to the male factor evaluation, the first and foremost is evaluation of the semen parameters. The next is doing the DNA fragmentation index of the sperm, also karyotyping, and also to rule out any comorbidities associated in the male factor. Now, coming to the female factors, let's go anatomical wise. Coming to the uterus, we need to do a 3D pelvic scan, and also it can be added with hysteroscopy, with biopsy, or immunohistochemistry. Now, why we need to do all these things is to rule out any conditions like polyp or adenomyosis or fibroid in the uterus, or if there is any developmental defects in the uterus like subseptate or septate uterus. Next is to evaluate your ovaries. You need to check for the ovarian reserve. To do that, you need to do anti-Müllerian hormone analysis. Also, if there is any endometriosis associated, you need to check that. Now, coming to the tube, see if there is any hydrosalpinx in the tubes or endometriosis or any tuberculosis history. You have to rule out all these things. Also, in the uterus, you need to evaluate to see if there is any shift in the window of implantation. This can be tested by a test known as endometrial receptivity assay, where we can identify if there is any shift in the embryo age and the endometrial age. Now, coming to the immunology, you have to check for antibodies, APLA screening to be done, or if there is any acquired immunological conditions like SLE, you have to rule this out. Then the final factor is being the embryo factor. You have to check whether the embryo is euploid or not. 50 to 70% of the cases, it's mainly because of the embryo abnormalities. Even if the embryos are looking grade A, nearly 40% of those embryos could be genetically abnormal. Even after evaluating all these things, nearly 10 to 15% of couple, the cause cannot be identified, and these couples are known as idiopathic.